You do a lot, so if you're really going to be like a nurse or a doctor, being a corpsman is a great start. I'm learning a lot, and I just feel like if you really want to go into the medical field, this is a good start for you. Hey y'all, this is your girl Sierra Aaliyah, and I am back again. It has been so long, but I wanted to do this video because it's been too long. So just a quick update. I have been working in the emergency room in Japan, and it's been a crazy journey for me. I literally just got up a 12-hour night shift, so it's 6 in the morning. And I am tired, and that's why I'm standing up, because if I lay down I might just pass out. While I was in the ER, I had to get my EMT, so I also have my EMT and I'm an ER corpsman, so that was a lot for me because I necessarily didn't want to do that, but everyone's required to do it. So I was like, you know what, this is a good cert, you know, I'm trying to go to nursing school anyway, this would be great to have on my resume. So it's been great. I've been out on stations, I've been on the floor, I've been learning a lot of things. So I just wanted to update y'all. But another reason why I wanted to do this video was because I wanted to tell everyone, like, if you want to become a corpsman, like, why you should do it. If you want to be a nurse or like a doctor, I think a corpsman is a great foot in the door, because as corpsmen we're allowed to do a lot of things, like more than an MA could do in the civilian world. So like as a corpsman, if you want to be a nurse or a physician, that's a good foot in the door. And then just by patients coming in every day, I'm learning, you know, their signs, their symptoms, their diagnosis, why this happened or why that's happening. And also being an EMT, that's helping a lot too, just like seeing the people who are coming into the ER and what they were diagnosed with and how they got it and what happened and all that stuff like that. So it's almost like the more you do it, we also give meds as a corpsman. So let me start over. I literally wrote down, I have a brag sheet of all the things that I've done just by being in my department. Let's see. We obviously do vital signs. As a corpsman, you're gonna do that a million times a day. We do vital signs, EKGs. We do plenty IVs a day. So if you really want to work on your IV skills, definitely corpsman is a great way to go, especially if you get placed in a department like the ER. We do IVs a lot. IVs, we do straight sticks, so like IVs, you know, even a catheter in the arm. A straight stick is like you just get your blood and go. We do sutures and suture removals, and suture removers is stitches, you know, you remove them. We do rapid strep tests, we do throat cultures, blood glucose, so any patient who has an altered mental status or a seizure, syncope, stroke, a history of diabetes, we'll do blood glucose to see where their blood sugar is at. We do intramuscular and oral medications. IV meds are only really done with the nurses, but I've actually done one, but nurse, he was with me when I was doing it. IM meds that we give a lot. Okay, I just found a new one. We give a lot of Tdap, we give a lot of Rocephin shots as an antibiotic, and we give a lot of Toradol for pain. I'm pretty sure I'm missing some more, but those are like the 3 main ones that we give in the ER. For intramuscular shots, and then for oral meds like ibuprofen, Tylenol, there's like Percocet and a whole bunch of other stuff, but like we give a lot of like Tylenol and ibuprofen. It's the ER. And then stronger meds as needed, and like a GI cocktail, Maalox and lidocaine mix, we do a lot of that too. Like I said, splints, so if someone comes in, it's the ER, so it's just a temporary cast. Nebulizer treatments, so for people who have trouble breathing or anything like that, we do that. Wound irrigation, of course, you done. Head staples, which is crazy for me because like you're literally stapling somebody's head. So head staples, or that one was crazy when I did a head staple because someone had a laceration of their head. I had to do some head staples. Visual acuity tests, we test their left and right eyes, the vision. Like when you stand in front of that chart, you do that. We do ultrasound guided Ivs. Now I've only done 2 on the patient, and those are pretty fun. It's like when the vein is really hard to find, you can use the ultrasound machine to find the vein. I've done that before. I've done that twice on a patient. I was like, oh my, like that was great. Oh gosh, that's all I wrote down. I know there's more, but okay. I just feel like you do a lot, so if you're really gonna be like a nurse or a doctor, being a corpsman is a great start. I never thought that I'd be here And like I told you, I'm literally just getting off my night shift, so I was just like, I gotta do a video. I haven't done a video in so long. It was a 12-hour shift. The night was smoothly. We didn't have any admissions or anything. It was great. We had a great night, but there's some days where we're packed, you know. I'm learning a lot, and I just feel like if you really want to go into the medical field, this is a good start for you. I never thought I'd ever be starting an IV. I've never thought I'd be giving shots, you know, and not had that nursing license behind me. Just kind of just being little old me. I never thought I'd be doing that. Just because I've been here for a year, I'm starting to pick on stuff, and like, it's really great. I just think if you really want to go into the medical field, definitely look into it. And not only look into it, but if you're going to MEPS and you have a recruiter, you have to tell them, I want HM. Like, some people just go like, well, I wanted it, but I got blah blah, you know. And it's just like, if you want something, you gotta go get it. I don't know how many times I tell people this when they DM me. I'm like, if you want something, you go get it. So tell them, I want HM, and if you're not gonna give me HM, I'm not joining. Or just be like, okay, well, if you can't give me HM, I'll go to another recruiter. And then if they say like, okay, then just be like, all right, and then go to another recruiter. Tell them the same thing. I don't want to join unless I get HM. It's so simple, because that's what I did. I had great recruiters, but I told them like, hey, I don't want anything but HM. So I was like, I'm not joining the Navy to get anything else, because I want to be a nurse, or maybe a PA, a physician assistant. I don't know now. And I've always wanted to be a doctor. That's just too many years though. But it's definitely great foot in the door. Like, you learn so much. I learned a lot in a year, and I never thought ever, because I used to be so scared of blood. Like, I've had vasovagal syncope, which is like, I'll be getting my blood drawn and I'll faint. Like, that's happened to me so many times. So I used to hate needles, I used to hate blood. But then like, working in this department, it's almost like you get over it so quick. You're doing so many a day and you're seeing all this blood that you get over it. So if you're a person that has a problem with like needles and stuff, you will get over it. It's just kind of like, you have to put yourself in that environment and just get to it. But I did want to make this video to let people know, one, hey, I'm back. Oh my gosh, focus. Hey, I'm back. And two, I just wanted to let people know, like, if you're looking into the medical field, being a corpsman, it would be perfect for you. Literally, I've done so much. I never thought I'd be able to do this without having RN behind my name. But it's crazy, as a corpsman you can. So I just want other people to know it's been a great year, great journey for me. I do not regret it. Like, I don't regret anything that I've done so far. Everything's been smooth sailing, and it's been a blessing, you know, getting to do what I've been doing. And the same thing for my sister. I have a twin, guys. Like, I know you guys have been, I thought it was her, but it was her. We have two different channels, and we also have the same channel. But even my sister's been learning so much at her hospital to talk all the time. So corpsman is a great, although we don't rank up as fast as everybody else. I just throw that out there because I just took the advancement exam and I did pretty decent on the test. I didn't even study, so I guess I could have done better, but I did pretty decent on the test, and it was a 1% pass rate for all the corpsmen. Every corpsman, all the corpsmen at every base, every command, every in the world, all corpsmen, it was a 1% advancement. So that sucked a lot. So for corpsmen, we have a low advancement rate. That's the only thing, but don't let that stop you, because it did stop me. I knew that before I joined, and it didn't stop me, and I don't regret it. Again, I still don't regret it. Become a corpsman to learn these hands-on things, nursing school, and I'm starting an IV. I'm like, oh yeah, it's like muscle memory. Like, oh yeah, I remember this. Like, got it. Thank you for watching this video with me again today. It's been so long, and what can I say? I am back, y'all.